Today, we're talking about healthcare in Moscow, Idaho. It's a small town, and because of that, I'm sure you have concerns about what's in the area and what you'll have to travel for. We'll talk about that and more, like general healthcare options, one essential membership that's a must-have in less populated areas like Moscow, and what I think is the best option for general healthcare for residents in Moscow. If you're new to the channel, you couldn't be in a better place to learn about Moscow. I'm Chris Carpenter, I live in Moscow, and I've been here for over a decade. Professionally, I'm a real estate agent, so learning about the Moscow area and its people is what I do all day long. If you want to get more info without going through the hassle of more online research, I've already done it all for you. This is my phone number. You can call, text, email, or scan the QR code. I'd love to help you out. Also, if you're already thinking about moving to Moscow, or if you're interested in buying, selling, or investing in Moscow, Idaho real estate, again, reach out. My team and I have successfully helped over 1,000 buyers, sellers, and investors in Moscow, resulting in over 1,000 five-star reviews. Between Moscow and Pullman, Washington, which is 20 minutes away and just across the state border, we have two regional hospitals. Gritman Medical Center for Moscow and Pullman Regional Hospital for Pullman. Those are your primary regional hospitals. Both are fairly small and considered to be critical access hospitals, which is a specific federal designation for rural hospitals. Based on my research, the criteria to be a critical access hospital includes having 25 or fewer inpatient beds, an average annual patient stay of 96 hours or less, and even though it's not the case in our area, typically they have to be more than 35 miles away from another hospital. In general, these types of hospitals aren't always able to fully resolve advanced emergencies or conditions. If they have a case that's beyond their scope, their role is to stabilize the patient and transfer them to a larger hospital or specialty care facility for definitive care. Gritman and Pullman Regional most often have their patients transferred up north to Sacred Heart in Spokane or Kootenai in Coeur d'Alene. To add some context to what might facilitate a transfer, most car accidents that involve injury end up being transferred out of our local hospitals. Similarly, lots of cardiac cases or pulmonary needs are either referred or transferred to larger hospitals up north. Now, if you're coming from more populated areas, something that we have are emergency flight networks. If you're not used to having an emergency flight network in your area, getting a membership in a rural area like ours is a must. Otherwise, if you end up needing a helicopter flight, it'll cost a lot of money. Life Flight has a unit stationed here at the Pullman Moscow Regional Airport, and you can get an annual membership for $85 a year. That's definitely worth the cost. Specialty care is where Moscow is limited. The specialty care categories I was able to find between Moscow and Pullman are cancer care, oncology and hematology, preventative and interventional cardiology, ENT, audiology, gastroenterology, nephrology, neurology, and orthopedics. Those are the broad categories. But if you want a full list of specialty care facilities to see if what you need is here, I put together an organized PDF with all the facilities I could find and links to their website. So you can either scan the QR code or click the link in the description. Fill in your info and I'll send it over to you. On top of that, we do have some general surgery options around too. What it comes down to is that we've got the basics covered and then a handful of bonus facilities for certain specialty cases. But healthcare here is not that robust. If you have needs beyond the list of specialty care that I mentioned, chances are you're going to be making trips to Spokane or Coeur d'Alene for the proper care. When it comes to general care, there are plenty of small clinics around town to choose from for your non-emergency needs, some of which are connected to the hospitals and some of which are not. We have a direct primary care provider called Story Family Medicine, which is my personal recommendation for general healthcare in Moscow. The access we have via text, email, or phone calls directly with our family doctor has given us a lot of peace of mind when unknown sicknesses pop up with our kids. Story Family Medicine has amazing connections, which means services that aren't included in the membership plan are normally significantly cheaper than going through a hospital. And the staff is absolutely top-notch. very professional and quick to listen, with an even-keeled demeanor and thoughtful yet honest bedside manner. If you're looking for more information on Moscow, Idaho, check out either of these two videos on the screen. They will be even more helpful information for you.